Hello, I'm Damon McCool, Public Programming Specialist at Eastern State Penitentiary, filling in for Marnie Penn. Welcome back to Prisons and the Pandemic, where we examine the ways COVID-19 is impacting the lives of incarcerated people, prison staff, administrators, and other stakeholders within the criminal justice system. There are now 41,290 confirmed cases of incarcerated people with COVID-19. That's an 11% increase since last week. In total, 489 incarcerated people have died from COVID-19, which is a 5% increase since last week. Confirmed cases among staff have increased 3% during that same time, now totaling 10,376. Staff deaths are up 7%, now totaling 45. Let's take a look at one of the news stories making headlines this week. The protests throughout the United States over the death of George Floyd have some health experts concerned about the spread of COVID-19. The close proximity of demonstrators, intermittent use of face coverings, yelling, chanting, and physical altercations with police could facilitate the spread of the virus. According to Dr. Barra Mathema, pathogens do especially well in crowded places like a protest. Dr. Mathema noted that out of an abundance of caution, many protesters and organizers were prepared with appropriate personal protective equipment. He concluded that for protesters, it was a risk worth taking with appropriate protection because the cause was so important to them. While there is no definitive evidence linking public demonstrations to the spread of COVID-19, Dr. Mathema says there are examples of clusters that emerged in places like Michigan following anti-lockdown protests. Would you participate in a protest during the COVID-19 pandemic? Why or why not? Let us know in the comments. We look forward to hearing your feedback. My name is Damon McCool. Thank you again for joining us for Prisons and the Pandemic.